The American Public Health Association is committed to health equity and bringing awareness to the social determinants of health. Today on APHA TV, we'll be hearing from experts about the current challenges we face in health equity and what more we can be doing to address them. Welcome back to APHA TV. My name is Dina Baer, and I will be continuing to bring you all the latest and greatest as we enter day 3 of this year's APHA Virtual Meeting and Expo. Let's do a quick rundown of some of today's virtual highlights. Be sure to check out the Monday general session, browse through the offered networking and engagement activities, get involved in the Million Minutes Challenge, and take a moment to stop by a session on the plague of firearm violence in America. Here to discuss the social repercussions of community violence is Milwaukee's Reggie Moore. Milwaukee's Director of the Office of Violence Prevention is here with me now. Reggie Moore, thank you for being here. Talk a little bit about how community violence plays into the greater scope of public health.
So in Milwaukee, when we developed our Blueprint for Peace, we understood and the community was clear that we can't look at community violence in isolation. When we look at indicators for health in our city, whether we're talking educational outcomes, whether we're talking mortality or infant mortality, access to affordable and quality food, all of those things are interconnected. And when we overlay disparities in other areas of health, if we overlay that with concentrated areas of gun violence or other forms of community violence, we see that the same neighborhoods have high concentrations of poverty, have had historic and persistent issues related to mass incarceration and general divestment financially. And so when we look at the intersection of that, we understood, and the approach that we took is that we can't look at violence as sort of community violence is the manifestation of a series of inequities and a series of failures of public policy, of lack of investment that have created the conditions for community violence to occur. And so even when we look at high rates of asthma, or we look at high rates of diabetes or heart disease, all of those things are interconnected and oftentimes are concentrated in some of the same neighborhoods that we see high levels of domestic violence and gun violence.
Can you tell us about the work you've done in Milwaukee to reduce community violence? It's been a challenging year.
Right. So in 2017, we developed our first comprehensive public health violence prevention plan known as the Blueprint for Peace. And we engaged thousands of residents of really driving both the strategies as well as the priorities for violence prevention in our city. And quite frankly, I feel like we were ahead of the curve. I mean, the calls around the country right now around reimagining public safety is essentially what we did. And so in 2017, we engaged in a very aggressive process to engage as many community members as possible, and particularly those in the communities that have been hardest hit by community violence and systemic racism in our city. And so, young people as well as individuals who have been victimized or survivors of violence, as well as those who have perpetrated violence in their past, all were a part of the conversation and the strategizing and really visioning what does our city look like, and really visioning it beyond the absence of violence. But what does it mean to have a community where opportunities are accessible, where young people have access to a quality education, where we're investing in prevention in ways that we hadn't done before.
Let's begin today's tour of organizations doing amazing work in public health.
The Global Infectious Diseases Institute was founded in 2017. Our mission is to stimulate, catalyze, and support new interdisciplinary research on infectious diseases of worldwide significance and prominence. And we try to foster interdisciplinary research by bringing together faculty from across the campus and a variety of disciplines.
The Global Infectious Disease Institute really tries to match new groups together. We need to get people thinking in different directions, and so we have brewing sessions, which are engaged dialogue and facilitated questions and interactions, solving problems they hadn't been thinking about before because we really want them working in new areas. And then we'll have calls out for seed funding to help them get started in doing that.
I think the COVID epidemic that we're currently experiencing has revealed to us that you can't just focus on science or medicine to solve this global problem. It takes all disciplines in order to tackle these notorious challenges.
The Johns Hopkins Center for Gun Policy and Research was established 25 years ago with a grant from the Joyce Foundation. The mission of our center is to reduce gun violence in America and promote justice and equity. A foundation of our work and our ability to have impact is really based upon the scientific rigor of our research.
Prior to the mass shooting at Sandy Hook Elementary in December 2012, there was very little public opinion information on gun policy, but in reality, there was really just an information void. I'm very proud of the work of Johns Hopkins and our center for being able to step in and begin a rigorous research approach to trying to better understand the contours of public opinion on gun policy in America.
Whether it's groups that are marginalized because of their documentation status, because of their race, because of their sexual orientation, everything that we do is geared towards enhancing their right to health.
Without data and without actually pushing for change, that change will probably never happen. And so having access to research, having access to a good department like ours is absolutely critical to improving the health status of people everywhere.
We have faculty that are social scientists, faculty that are epidemiologists, lawyers, and so that inherently injects an interdisciplinary and multidisciplinary lens in the research approach.
The department has never been more robust, and our students have never been more enthusiastic. We see ourselves as partnering with the community to make change and improve health outcomes.
I'm the director of the Center for Health Equity at the Louisville Metro Department of Public Health and Wellness. Our mission is a Louisville where everyone in every community thrives by expanding our reach when it comes to advancing health equity across our community.
Racism is a system that concentrates power for some by concentrating scarcity for many. So racism is fundamentally depressing the quality of life for all of us and reducing our ability to experience joy and wellness because our systems are designed around unfair power. The Center for Health Equity tries to advance health equity in a few ways. We analyze data to be able to tell the story. We try to support our partners, and then we really try to help shape a worldview for people that says we do deserve better.
Healthy People 2030 essentially is a roadmap. It's a 10-year plan that is now going on its 5th iteration. This is our 5th decade. The Office of Disease Prevention and Health Promotion here at the Department of Health and Human Services, which leads the Healthy People Initiative. We are looking to discuss what Healthy People is all about to begin with, but also to discuss how it's evolved over the past going on 5 decades from what its original intent was. We hope that the audiences are able to learn about the way in which Healthy People 2030 has developed, particularly how data requirements and the methods that we've applied have become more rigorous and stringent, such that the targets against the objectives of Healthy People 2030 have added value. For this decade, Healthy People 2030 features most notably a smaller set of objectives and a more refined set of objectives, frankly, based on those more rigorous data that I mentioned a minute ago. We also have new objectives that are based on some contemporary issues, such as e-cigarette use, flavored tobacco use in adolescents, of course, and unfortunately opioid use disorder. Leveraging healthy people, the objectives, the resources isn't just for the medical or health professionals, that it's really about all of us. That this isn't an HHS initiative, that this isn't just even a whole of government initiative, but that it's really a whole of society initiative. So it doesn't matter whether you're a policymaker, you work in business, you work in the faith-based organizations, or in the nonprofit community, or in traditional public health sectors. All of us have a role to play in advancing the health of the nation, and therefore we all ought to be leveraging healthy people for that purpose.
That's it for us today. But remember, we'll be back each day of the virtual meeting with more exclusive material. And don't forget to keep up with all the latest developments and get in touch with us via the web. We'll see you tomorrow, APHA.